Hello, hello, everybody, and welcome to our 12 o'clock session. I'm so glad that all of you can join. I see our three presenters are here, so I will introduce them in a minute. And I'm so glad I know we had a little bit of technical difficulties with the Zoom link, but I'm glad that all of you got my emails and text messages right now. So thank you all for being here. So I am again, Lily Cameron, and I'm the team director of the International Ministry of Ashland. And it's a newly found ministry that helps refugees and internationals. And so we're so excited for hosting this session. The medical field is very near and dear to my heart. I'm a physician by training. I trained at VCU. So I was very excited to have all of our panelists here today to let all of us know how we can best help the international community with accessing healthcare, mostly at VCU, because all of our presenters are from VCU, but in just the various different arenas. So I will go ahead and introduce our panelists, and then they'll each speak for about 10 to 15 minutes. And like previous sessions, just go ahead and save your questions for the end. And then we will go ahead and have a question and answer session after everyone has finished presenting. So we have Carla Tinsley. She is the Director of Pre-Doctoral Clinical Operations at the VCU School of Dentistry. And she's going to let us all know about the wonderful system that they have at the VCU School of Dentistry and how to get a patient to the dental school for help. And she's going to let us know how that works if you have Medicaid versus being uninsured versus other insurances. So thank you, Carla, for being here today.
Thank you for having
Um,
me. Good afternoon, everyone.
yes, and I'm going to go ahead and introduce all our speakers, and then we'll have you go ahead and speak, Carla. Thank you. So we also have Dr. McKenna here today. So he's with the VCU Health System. He's a primary care pediatrician who sees patients at the Children's Pavilion. And when he isn't busy taking care of his kids in the clinic, he serves as the interim chief information officer for VCU Health. He's also very interested in medical education for medical students and residents. He conducts a global health mission trip to Peru every year. He has an NGO in Nicaragua that coordinates care for medically complex children. And he is one of the physician champions for the VCU Medical Legal Partnership. Dr. McKenna, we're so glad to have you here today as well.
Thanks for the invite. Excited to hear about this.
Sure. And then our third panelist is Mitzi Cohort, and she is a clinical social worker and she works with VCU Health Coordinated Care and Post-Acute Services team, and she's done a lot to support the immigrant population at VCU Health. And she's going to help let us know also of how to get patients into the VCU health system, what we can do as providers of going alongside our refugee and immigrant population, how we can let them know certain things about the VCU system that they should know before their appointments, and when they're trying to get to their follow-up appointments, what information they need to have, and how we can all help partner with VCU to give a better experience to our international community. So Mitzi, thank you so much for being here too.
Thank you for having me. I'm excited. Happy Saturday.
Yes, thank you. All right, so we're going to go ahead and start with Carla, and then we'll go to Dr. McKenna, and then we'll go to Mitzi. So go ahead, Carla. It's all yours. And I know a lot of you have sent your presentations to me, but you can also go ahead and just share your screen, and that way you can work through your PowerPoint at your own pace.
Okay.
Thank you.
Hello, everyone. I'm here to provide some information about VCU School of Dentistry. So we provide comprehensive overall dental care for basically the state of Virginia. We have student dental providers as far as for dentistry and for dental hygiene. We offer patient-centered care. And so our aim is to provide nationally acclaimed programs that endeavor to be among the best for dentistry. We strive to help our students become first-rate professionals that share in our core values of honesty, integrity, hard work, dedication to betterment of humankind. And so there's a bit of a process to become a patient here at the School of Dentistry. And so we ask that patients contact us to schedule a screening appointment. A screening appointment basically involves a dental examination along with taking some x-rays just to evaluate the case to ensure that the case is not too complex for a student. If not, then we have other options within the building. But as long as the screening appointment goes well and the patient is approved to be a patient of the dental school, then we move forward with assigning them to a dental student provider. And then at the next appointment, we're gonna do another evaluation, take a little bit more, a couple more radiographs just to establish a treatment plan and move forward with dental treatment for the patient. Once the treatment plan is completed, then we evaluate the treatment as well as the fees with the patient and explain everything that's going to happen and how we move forward with treatment. As long as the patient is in agreement, then we move forward. Now, as far as how insurance plays a role into this process, we do accept, we're only in network with a few dental insurance policies at this time. That would be Delta Dental, Cigna, and Virginia Medicaid. But to try to give a little bit more information about Virginia Medicaid, because the idea is that it provides coverage for all treatment. It does not, but we would sit down with the patient after their treatment plan is completed to go over what type of coverage is provided for the treatment that is planned for them. And then at that point, if there are pre-authorizations that's involved that we have to submit, then we'll submit those. In the midst of doing all of that, we want to remain in communication with the patient to provide the best patient care and to provide clarity to make sure that they understand the process and where and how we're moving forward with treatment, so that if there are any out-of-pocket costs, we can communicate that ahead of time. And so that's a bit of the process. That's the beginning of the process to provide overall comprehensive dental care. And that can start with the cleaning, move forward into filling. We provide gum disease treatment, extractions all the way to extractions to a crown, a bridge, implant, and dentures. And so making sure in the process of providing all of this dental treatment for the patient that we communicate with them, that they understand the process for the dental treatment and how insurance coverage plays a role in that. And so throughout the presentation that has been provided to you all, I'm hopeful that everyone will take a look at it. It does give an idea of the type of coverage that's provided through Virginia Medicaid for dental. And as far as what's covered up front and what maybe have to be determined through a pre-authorization for coverage, because there's not all coverage for all dental treatment. And so I hope I provided some information. I didn't want to take up all the time, but because I can talk about this forever, I'm very passionate about our environment and our dental students and the treatment that they provide to our community. We provide the best patient care here, in my opinion. And our students are excellent, and they're guided by faculty that we have on board here as well. And everyone is passionate about making sure that all dental needs are met within the community. Are we
Thank you
taking
so
questions?
much. Thank you so much, Carla. We really appreciate you sharing all that. And I'm sure people are writing down their questions to ask you at the end of all the presentations. So I appreciate it. Thank you, Carla. We're going to turn it over to Dr. McKinnon.
Yeah, that was great. Thanks, Carla. I agree that the dental school is terrific. Patients ask me all the time where they should go for their dental care, and I tell them just stay with us. This is the spot. So I'm glad to know that there are resources there, and I'm really glad that you spoke first to some of the complexity of navigating the system or getting access to the system. That's definitely not an area where I'm an expert. So what I'd like to talk about a little bit is some of the mission of VCU Health and Children's Hospital of Richmond, and some of the ways that we'd want to be sure to advocate for these patients right off the bat with sort of a primary care medical home. The good news is that all families in Central Virginia and in Virginia at large have the resources of Children's Hospital of Richmond at all times. We take care of Medicaid patients, insured patients, uninsured patients, indigent families. We take care of families from outside of our state. We take care of patients from other countries who desperately need our advanced medical care. So I think we're an incredible resource, and I'm excited to be a small part of it. But what is the reality, as I'm sure all of you know, is that these systems are complex to navigate. It's not easy to gain access and to find your space within them and to find the resources that you need. So I think that's why we're all talking today. So I'm actually planning to learn probably more than I teach on this one, but I'm happy to share my own personal experience after 20 years of being a primary care provider here in Richmond at VCU. This is the only job I've ever had. It's been an incredibly fulfilling job. And the biggest part of it is the patients, their families, and our team. So I think that, as Carla was saying, we have an incredible team at VCU. I'm surrounded by brilliant clinicians and navigators and financial aid people. I mean, it's just everybody works together to make sure that these kids get the care that they need and their families feel secure and comfortable that their children are well cared for. But I think also, you know, we have a great patient population. I mean, I think that there's a variety of patients that we see. We bring patients from the inner city, we bring patients from our rural communities, and we have huge international populations here. I think any of us that would care for these families, whether it's, you know, you guys taking care of refugee families or those of us just taking care of families in general, we know the challenges that non-citizens face, be they legal immigrants, illegal or undocumented immigrants. Like you, I probably don't like that term illegal, but if I'm going to make the comparison to legal. So legal status, undocumented status, and then refugee status. I think that refugees have a very particular set of challenges, but the good news is they also, it seems to me, not as an expert on their care, have a lot of resources to which they are allowed access if they can just navigate that system. So I'm so excited to hear that there are navigators like you guys out there. So, and also following in Carla's lead, I don't plan to take up a full 10 to 15 minutes, and I don't plan to do PowerPoint. I think the interesting part of this is going to be when we all have a conversation at the end. But some of the points that I did want to bring up, VCU Health has a very clear mission to provide quality care to all patients who need it. That's one of the exciting parts of working there. We are a safety net facility. So one way or another, we're going to care for every person who needs it. Unfortunately, for those that are uninsured, that can sometimes mean through our emergency departments that are already sort of overburdened and understaffed. But our emergency departments are always there for patients with critical needs. But as a primary care provider, I think that the system breaks down when we just route people to the emergency department. So I do want to emphasize emergency department always there, but I want to give them some cover because they have a lot of important work to do. So for non-emergency situations, what we have to do is figure out how to help these families navigate that system. Medicaid is the key. Medicaid is an incredible resource. It covers the costs of essentially everything I've ever wanted to do or one of my families have needed. That's not always the case with all insurances, and it's certainly with any insurance, including Medicaid, is never perfect. But if we can get our patients Medicaid, then we can really be at it's almost luxurious then for the care we are allowed to provide. So that would be my initial emphasis is as soon as you're dealing with or working with a family, regardless of their status, the application should take place immediately for Medicaid now. If they are simply undocumented and don't have asylum or refugee status, then that Medicaid application may not be successful. But if we are able to succeed in securing Medicaid, then we will be set and we'll be able to do everything we need to do. Now, the period in between achieving Medicaid coverage, like applying for Medicaid coverage and achieving it, does provide a bit of a desert for some patients in where they can receive their care. VCU does have what we refer to as an indigent care program. So we have financial assistance. Again, that's not my role, so I'm not an expert in this at all, but I do know how to route a patient to them, and I usually just go to our website and click on the link that says financial assistance. All you have to do to qualify for at least the application process is be one of our patients, have an income below 200% of the poverty level, and have some form of status, whether you are a citizen or what is included in the list that would apply to this discussion is asylum. The biggest gap in this care are as a pediatrician, are patients who were brought here with their parents and weren't born here. Getting coverage for them proves very challenging, and you really only can get a year of indigent coverage. So for a healthy child brought here from Central South America, where I do a lot of work, it often is not possible to provide them basic primary care in our system at VCU. So I don't want to try to sell what we can offer as limitless. But what I do want to return to is that, again, we are an incredible resource for the community. So if a child needs critical care, we are going to provide it one way or another. We will find a way to do that. But in my own space where I'm providing primary care, there are some gaps that prove very challenging. So it is a reminder what I found in just looking, and others will have more information on this, I'm sure. Refugees do qualify for Medicaid, which should go, I think you just go to coverva.org is what I was able to find, and just get that process rolling. Then the next step, I would say, after you've applied for Medicaid is to establish primary care or a medical home. Primary care is the job that generalists do, general pediatricians, internists, family medicine providers, a lot of our APPs, nurse practitioners and PAs are parts and members of primary care teams, and a medical home is the place where a patient can go to begin their journey through all of healthcare. So having a primary care provider doesn't necessarily mean you have a medical home. A medical home is a whole separate designation that says that we have the resources that you need. You have the access that you need to our team. We know how to help you navigate. You know where to go and how to find us. We have hours that meet your needs. We're convenient. If we're 50 miles away and you don't have a car, then we can't provide a medical home because that's too difficult for transportation. So those are some of the challenges that we face as primary care providers trying to create that concept of a medical home. And what I would say is the clear medical home for refugees upon arrival is always going to be our health department. Our health department is dedicated through the state of Virginia to providing care for any families that can't access care otherwise, and they do have a specific refugee program. Now, I'm, again, not an expert on that. I'm not from the Virginia Department of Health, but that is where when a lot of patients ask me, not in the clinics, if they're in the clinic, they have their access. But if people ask me, where can I go to get vaccines for my child who doesn't have coverage? We say, go to the health department. They're there for you. They can provide that care. And that is where a refugee's process, as I understand it, begins with an initial evaluation. As Carla was pointing to, there is always the need to get that sort of initial evaluation to understand where a patient is in terms of their health. And so once we've done that, we may realize that we're in need of a lot of attention. And that is then where the Department of Health would turn. They turn to us to provide care. If it was something like cardiac care, oncology care, pulmonary care, all of those things we provide, and we have that resource ready for anyone who needs them. But if you do see and screen a child who is healthy and doing well and all they need is their vaccines, they'll probably just stay within that Department of Health medical home until Medicaid is established, and then they can choose. Not every pediatrician's office accepts Medicaid, so if you're looking for a place to send them, I can definitely tell you we can take care of them. We're a Medicaid resource, and we have the space that we need in our new children's tower and our new children's pavilion. So the things that you would look for from a medical home, you want guidance and support. You want this family to feel like if they have a question, they know where to go with it. You guys as navigators will often be a first resource. It sounds to me like the sort of work that the community does that's sponsoring and attending this meeting would be a resource for these families. So they may turn to you first and foremost. But what I usually try to emphasize to my patients in that context is, I am your resource for everything you need medically, even if I'm not the doctor who's going to provide it. My team and I can help with that. So what you want, again, is you want a clinic and a team they can access easily, whether it's physically or virtually. And you want them to feel confident in that team and to feel safe coming to them. And then our job is to just provide excellent medical care, which I think you can really get in a lot of different venues across this Richmond community. There are incredible pediatrics offices all around the community. As I said, the health department is great, and I think our team at VCU is terrific. So as long as you can find them a space where they can receive care, I think they're going to be in really good hands. But they will have to advocate for themselves in many ways. And then if they feel like their team is not advocating or joining them in that advocacy, I would say that's not necessarily what they're looking for in a medical home, and it may be time to try to find a different resource. And then the part that I was referring to virtually is one of the ways that I think my job has become most exciting. And Lily, you mentioned that I have a side career in informatics, which is using technology to benefit healthcare and patients. As a primary care provider, what I've found is that access through portals is really key. So I would look as navigators to get your patients enrolled in a patient portal as soon as they're joining a clinic. And if they're joining a clinic that doesn't have one, then I'd be worried about that patient's ability to connect with that team, especially because a lot of our refugees and immigrant families are limited in their abilities to get transportation, to leave jobs, or to not attend events. Like I know that you guys, I saw some of the resources that are provided for these families, which seem amazing, like things like driver's training. If you're trying desperately to get your resources organized and get a job and get a home, you can't necessarily go to 5 appointments in a month. You've got to just be able to go to the one critical appointment, which is why I really encourage my families, no matter what language they speak, to send us the message that they have as their question. Now, if they can do it on their own and translate it into English somehow, that's terrific. But we have an incredible language services team at VCU Health. And so if I get a message from a family that I don't understand, I can do it in Spanish. But if I get something in any other language, Arabic, Farsi, any of the Middle Eastern languages, any of the Asian continent languages, we can send that off to our team. They can translate for us and we can get that information back to the family. So it does take a little bit longer when we have to go through interpreter services, but it still is an incredible resource that we can provide. So what I would say is make sure that they've found what they consider to be a place that they can access reasonably physically and a place that's offering some degree of access virtually in that. And then the last thing that I wanted to emphasize on this is that within that, even when I was doing my reading, I'm sure you guys are experts on the Refugee Medical Assistance Program through the Virginia Department of Health. So it sounds to me like that is the piece of getting that VDH access that you're really going to want to emphasize and make sure that we have in place. So again, Medicaid, when they first arrive, that application should go in immediately. They should go to the Virginia Department of Health to get that first health survey. And then the Department of Health will reach out to us, almost guaranteed as a resource, if they identify critical needs in children, and we'll meet that. And if those things all fall apart and you have a family that clearly has some unmet medical need, our emergency department is always available. I don't want us to go straight there, but I do want to remind everyone that there's no questions asked when you arrive at an emergency room. They will take care of you and make sure that we have that kiddo stable and safe. Thanks, you guys.
Excellent. Thank you so much, Dr. McKenna, for that wealth of information. Misty, we're going to go ahead and turn to you now.
Okay, well, good afternoon, everybody. So I'm actually going to share my screen here for you all. Let me know if you can see it. You good?
Yes, we can see that now.
So my name is Misty Kozar, and I'm a clinical social worker at VCU. I've been there since 2016. I started in the emergency department and kind of went through I've kind of been everywhere. And in 2020, I had the opportunity to go over to Children's Hospital, which is absolutely amazing. I worked for the PEDS HEMONC team, which is our kids with cancer and serious blood conditions. When I got over there, I had always worked with lots of immigrants in the emergency department and things, but I was not yet prepared for what I got when I got there, basically. A fourth of all of my patients, I had solid tumor patients that I was following. So we start them in the clinic and we follow them all the way through treatment. You're holding their hand through clinic, and then also through either being clear from cancer or sometimes, there would be death there. You were helping these families and supporting them. So when I got there, a fourth of all of my patients were immigrant kids. And like Dr. McKenna had said, we had kids that came in that were from other countries. Some of these were undocumented children. And Chora is so amazing because I worked with someone there that actually provide immigrant services, and they have this fund set up to basically provide for care for kids that do not have insurance. So at that point, I really started digging in, and I had to learn a lot of additional therapy skills, looking at traumas that they dealt with. I'm going to kind of talk about a little bit here today, that we are not so much as children that are from here, that are U.S. born, would not be exposed to, right? And so I am a child of an immigrant. My mother is an immigrant, and so I've always been, involved in looking at the barriers to families and the difficulties that just these families work with. And I can say that I personally experienced that. So again, I have a master's in social work. I'm also working on an MBA. I finished my MBA in December, actually, at VCU. And one of the reasons I went for that was because I was working with these families, and I was seeing I really needed to have finance business background to be able to understand how to get funds and things. So can I just talk about the demographics really quick of these families? I want you to look at 1990. In 1990, we had 125,000 kids here in Virginia. I'm sorry, in the US, that are from immigrant families. In 2019, y'all, we go to 440,000. So look at that massive increase of immigrants that we have. About 1 in 20 children in this state live in a home with at least one undocumented family member. Okay, 1 in 20 kids, that's a lot of kids. 1 in 6 Virginia workers are immigrants. That comprises 17% of our population. And here's the kicker that really gets me. 59.8% of immigrants in Virginia do not have insurance coverage. And I'm going to talk about that. Some of these do qualify. 70,000 children in Virginia alone right now are immigrants. 106 immigrants live in Richmond metro area. In 1990, again, 125,000 CIFs, which are children of immigrant families. And in 2019, 440,000. So you can see here, I did a quick diverse population of kind of where our families come from this is specific to Virginia. So kind of look at that. Okay. So the barriers to health and resources, and I have stories to share about all of these. And I met the most amazing families, and I'm still in contact with some of them. I've gone back over to the care coordination side where I actually work with training new people. And but this is the heart of what I want to continue to do. Children in immigrant families are nearly twice as likely to be uninsured as those in non-immigrant families. And I want you to think about, as a parent, we take our kids to see their physicians, right? We get them to care. We do preemptive services. Most of the kids that I was seeing, if they were immigrant kids, a lot of times by the time they were getting to us, they were in stage 3, stage 4 cancer because they had not gone to a pediatrician. They had not been screened. And one case particular of a patient, had this patient been screened, in stage 1, that child would have survived. And so we got to make sure that they're able to get in and get these screenings. And CHOR is just incredible because they make sure that these kids get this coverage. Undocumented kids, 59% do not have insurance coverage. That's undocumented families. This is not just children. 40% do have insurance, right? So that's I don't know how that comes, but they have insurance. Eligible for citizen status, 20% that are eligible for citizen status. So that's almost like 1 in 4 people do not have insurance. So when you guys are out there working with these families, if you can help them get their Medicaid, that way they get with primary care physician and they kind of remove some of those barriers that we're seeing in healthcare. 79% do have insurance. So I want you to think about, if your kid isn't going to a primary care physician, if they're not seeing somebody on a regular basis, there's a lot of other things that are going to happen. And I saw that specifically over at CHOR, and still do when I meet with the families that I work with, more adults per se, but their families overall. So that's a high number. There's some unique stressors that our immigrant kids have, and also the family overall. So I want you to think about this. You're working with, at CHOR, we're working with kids, or over at the hospital, we're working with families and dealing with different stressors. Just, a recent diagnosis and that is not positive for you, right? That's hard enough for kids or for families. But these families are looking, you saw I said 1 in 20 kids in Virginia are living with one parent who is undocumented. Okay, just one. Those kids their parent faces the threat of deportation. And imagine that, because I'm gone away from my kid for 1 day and they're freaking out, right? Imagine being that kid. If parents or caregivers are deported, these children may have an increased risk for health problems, deficits in academic treatment, and mental health concerns. So that affects the whole family. If a family member or caregiver is deported, the loss of income can cause loss of housing or even food instability. I've seen these families go into homelessness. So be mindful of these things. When you're working with a family, if one of them are not undocumented, these are things that are going to be really scary for them. Children and parents may have experienced abuse. So I've worked extensively with abuse in kids, but these kids were seeing physical, emotional exploitation. Many kids have been through war, right? Extreme trauma. There was a study that was conducted at Boston Children's, UCLA, and Duke that found that only 29% of all of those who had experienced war or political violence were receiving services for mental health concerns. Guys, they have been through war and political violence, the things that some of these families have seen, and only 29% are getting mental health treatment services. That's a serious concern for me. Refugees have 10 times increased likelihood of suffering from PTSD. So there's a major need here to deal with these mental health issues. And so if they're not getting Medicaid, okay, which that's something you guys can really help out there, help them get to clinics, help them make, and I've made resources, and I'm going to kind of hit on that resources, different people in the community that I work with to refer. And what you guys do is amazing. I send people to Reestablish Richmond all the time. But there is a screening that if you have the chance on your own time to go to harvard.edu, it's Boston Children's created this, and they have just an amazing program that they have created for working with immigrant kids and families. But these are some stressors that when we're working with the psychological and psychosocial issues of these families and trauma, that we don't necessarily see in a baseline population that's just in the US or a kid or a family. These families are dealing with environment, okay? They're dealing with trauma, social support that they have because they may not have that support system. Acculturation, when you ever been like, I moved here from outside of Virginia, just becoming like a Richmonder was hard enough just to know where everything is. Imagine coming from a different country, right? So that's acculturation stress, parenting capacity, the language alone is just a barrier, you know. When I got here, I didn't say like, I didn't talk like a Virginian. I'm from the Midwest and you can probably hear it, right? But imagine if you do not speak that language, just the barriers, right? To not being able to communicate. Then there's this discrimination and stigma and violence. We have isolation that happens. And so if you guys can help with support systems and group support where they're communicating with one another, I mean, group support is amazing because they're sharing those feelings, you know, what they're going through, and then helping them to move into resettlement, which is healthcare and access to services. And that's what we're talking about today is helping these families. They've been through trauma. They've been through a correlative stress where they're accurating to the society. They've been through isolation often, but now we want to help them have a successful resettlement. So we have to make their basic needs, and their basic needs are going to be, you know, food, housing, shelter, jobs, employment, training, and then dealing with their legal status. That's a big concern for these families. And then ultimately healthcare and access to services. These kids that I worked with, these families have absolutely been amazing. And I noticed that, you know, we have to be able to, when we assess a family immediately, like Dr. McKenna said, do you have Medicaid? And like I said, a lot of these families that I would work with are like, I didn't know I qualified for Medicaid. And I'm like, you do qualify for Medicaid. And so helping them connect with the Medicaid services and getting that application started. And like Dr. McKenna said, they can help you. You can get on the phone with Medicaid and I'll provide a phone number and they'll put that family in with their own language. VCU has an amazing language system here that I've worked with extensively. And I'm going to show you guys. I had a great student, and he worked with me, a therapist that worked with me while I was over at Chore, and he spoke fluent Spanish. And so we went through and found all of the different resources, and there's probably more that are out there in Richmond alone. And we made this to where it was Spanish or English to Spanish. So that way we can understand what we were giving them. I don't like giving information to a parent family if I don't know what it's saying. And so we sent this to language services. They double checked it, made sure it was accurate. And then we produced this. Care coordination as a whole has put this up on their website. So everybody, any social worker that works in care coordination goes to this resource. I would like to create one in every single language. I just honestly haven't had the time. So if you look here, there's Bon Secours Caravan. And if you want a copy of this, I don't know, I asked Lil if we could email this out to everybody. You can reach out to me directly. But we have Bon Secours Caravan, Child Savers, Central Virginia Legal Aid Center, and this is all in Spanish. These families are so great. I'll hand it to them and I'll say, English, in Espanol, and they're like, oh yeah, they love that, right? Because it's in both. And then I know what I'm telling them. Commonwealth Catholic Charities, Crossover Health Clinic, Feed More, Latinos in Virginia Empowerment Center, Reestablish Richmond. I mean, what you guys do is just unbelievable. Sacred Heart Center, Safe Harbor, Virginia Hispanic Foundation, and Virginia Poverty Law Center. So we're giving this to our families when they come through our system. I think the biggest thing is being mindful of all of the different things that they have been through, and sitting down with them and saying, you know, and it's going to take a while. You have to establish a relationship with them and make them feel safe. But being able to deal with, like I said, getting them into that resettlement stage of where their health care is taken care of is imperative. And then mental health is a whole nother thing that we've really got to dig into. And something I would love to see is that there's nothing like small groups where these families are getting together and they're able to communicate and say, hey, I've been there. And that happened a lot with my Peds Hemont clinic. One last story. I had a mom from Guatemala and a mom from Dominican Republic, and both of their kids were in treatment. One of the kids had already gone completely through treatment and was in just follow-up care, had been through awful treatment. And this child was coming into treatment. These mamas found each other and started communicating. They became friends. The next thing, and I'm in the middle of them communicating with a translator. It was the best. I love these guys. And the one mom helped pull the other mom through treatment. They were together through the whole thing. They became best friends. They've got more people in the community. Both of them had legal representation. One is since became a legal citizen, and the other one is getting there as well. So they help provide that support for each other, and you know, just things like getting transportation and everything. And so it was really beautiful to see them. And then I connected them all together, and I'm like, you all need to be talking. You're all from, you know, you're all immigrants. So it's just really, that community support is absolutely imperative. And I have to say, I was a part of another hospital system before I moved to Richmond. We really have a great system here, and Chores just loves these kids. So if you can get the families to us, but navigating the systems is hard. I mean, just getting to VCU alone, trying to find parking is really a mess. And so if you can be there to hold their hands and help them get there, it'll make all the difference. So thank you.
Thank you so much, Misty. And before you stop sharing your screen, can you just go ahead to the next slide? Because I think when you were talking about references, it wasn't coming up for everyone to see.
Oh, okay.
So yeah, so here's some of the references, and the PowerPoint that Misty sent out will be available, as well as the recording of this session. So for all of you guys to be able to access that, that would be great.
You mean the immigrant health? The immigrant health one, is that the one you're talking about?
Yes, the immigrant health one. Yeah, that one didn't come up.
Oh, I'm sorry. Let me open that for you, and I'll email that to you so that way you guys can see that. I'm sorry about that.
Wonderful. Yeah, I know. I remember you emailed it to me, and I saw it, and it was such a wealth of information that you had put together, which was amazing. So yeah, if you can share that, that would be great. And then, so I thank all of our presenters. I think that was really amazing for you all to share just the different facets of not only CHORE, but VCU in general, and then the dental school. So I know a lot of people have a lot of questions, and so we'll open it up to questions. You can feel free to unmute yourself and ask your question, or I'll also look through the chat function to speak to all the questions here. I know we already have some questions coming in. So one, I'll go ahead and read to Misty and Dr. McKenna, learning about these unique, oh, you guys are, okay, hold on. I got to scroll my chat function up. Learning about these unique issues facing refugees in Virginia and obstacles to healthcare, as well as the growing refugee population in Richmond. I'm wondering if there are any talks at VCU or any concrete plans to establish a standalone refugee clinic in Richmond, such as the International Family Medicine Clinic at UVA Health. Great question.
I will refer that to Dr. McKenna. I do know the one at UVA, and I connected with them extensively because there's a lady over there that's just amazing. I got information from her when I was starting this whole thing, and initially reached out to Reestablish Richmond and connected with you guys a long time ago. Their focus is really on refugees. They really do not get into so much immigrants, and then also undocumented. So I would like to see us go that direction, but I don't know at this point.
Yeah, I'd actually have to beg ignorance as well. I'm not sure. I know that we did start a refugee program several years back, but I'm not sure where it's gone. So I apologize, but we can certainly try to track down more information provide it later.
Excellent. Thank you so much. And then Khalil posted that VCU also has a resource line for mental health resources that can help link people to provider resources, not make referrals, just identify providers. So this is really important. The VCU Mental Health Resource Center, that link is included here. So thank you so much, Khalil, for that. And then Cleo also says, don't forget the local CSBs, which is a community service board in every county. And that's a great resource for families and children that have mental health needs. There's the Richmond Behavioral Health and Hanover, Henrico, Chesterfield CSBs. And that can be a vital link to help a child and get them to the right resources.
Child Savers is also absolutely amazing. I've sent a lot of kids that are in, that have gone through need therapy and things. They're awesome, and the CSBs do a really great job. I think with your organizations that you're out there, there's nothing also like connecting these guys to each other. Just that support system. There's nothing. When I meet somebody who's from St. Louis, it's like immediately they become my best friend, right? That connection is really important as well for the mental health and the social function.
Excellent. And I think it is also important for all of our volunteers to know, like one of you had mentioned, that it is great if we can go with our clients to their appointments at VCU to help them navigate the system, especially if they don't speak English. And I think just to make it clear, regarding what Carla was saying, I think it's really important. Like if you have a family that, let's say they already had a screening somewhere else and they know they have a cavity, but they need to get it filled, but they need maybe some other services and they want to come to VCU, it's really important to let them know that at the VCU School of Dentistry, they still need to have their screening appointment. Even if they already know what their problem is, they can't just go in for a treatment of their filling. They can't just go in for implants or crown placements. They still have to have that initial screening to get into the VCU dental school program. And then they get placed with either a student or a resident, and occasionally maybe a faculty member if they have a very complex problem. So, all right. And if anyone has any questions and wants to unmute, that would be good too. And I'm going to be looking through the chat here. To see if there's any other questions. Cameron Gallagher Foundation, Dr. McKenna was mentioning, is a great resource to access mental health services. And they have a partnership with the Virginia Treatment Center for Children. Yeah, go ahead, Dr. McKenna.
I just definitely want to agree with Joe, shouting out the free clinics in our community. I think that they provide incredible resources. So accessing those crossover clinic is the one that we refer most often to in my own practice. But again, it depends. You always have to check the fine print on what services they provide for children. This isn't a discussion of children's healthcare. This is really refugees in general. My purview is children.
I have a question.
Yes.
Yes, I'm Lena. Actually two questions. One is dealing with like people who actually have disabilities, physical disabilities, how easy or how complicated it is for them to get assistance or help navigating this new world that they're in. And number two, I'm very concerned, and a passion of mine is like addressing loneliness and mental health. So again, how easy or difficult is it to convey these terms? Because again, even in America, in the African American community, there's this humongous stigma around like we don't talk about that kind of stuff things. So like what kind of techniques are you guys using? Or is it a certain type of wordage that you are using to convey those thoughts, to address those issues? So if they do need help in those arenas going forward, they know or understand.
Yeah, I think that's a great question and a really challenging one. For me, it comes back to that medical home concept. I think that it's really hard to deal with any of the loneliness and the isolation of any number of these statuses. So whether you're talking about a health situation which can be incredibly isolating, or refugee status, being a person in a new community, in a new country with a new culture. All of these things are potentially isolating. And I think that's when Misty pointed out that connecting to other community members, I think that ends up being one of the keys. But I don't have that sort of, I often find myself feeling inadequate in that space. Like I'll tell families, see where you can connect within your community, see who you can reach out to. But for that medical home piece, I think that as a primary care doc, that's what I can speak to. It can feel very confusing, the number of providers, the number of prescriptions, the number of therapy sessions. So I think that that's where I emphasize to my families, like, you shouldn't feel alone. If you have a medical home, you should never feel alone in this. You may feel confused and you may feel intimidated and overwhelmed at times, but we're always your resource. So again, that's where I know that these families are often isolated. They're a little bit further away from the clinic. I emphasize almost all of them seem to have a phone, and I tell them, with that phone, you can access me. You can get in touch with your medical home. We can help you with your questions. And I think that's what often leads to a lot of unnecessary emergency room visits, is when someone's alone and feeling frightened and they don't know what happens next and they don't know where to go next. They'll just go and access resources that way. And I think that can be a very challenging situation for both sides. I think the patient often in those situations feels like their needs weren't met, because that's not what our emergency departments are meant to do. And the emergency department feels frustrated because they're not able to meet those needs. They're not able to handle those sorts of concerns. They can't do that mental health work in a brief ER visit. So that's my goal, is always to make people feel like they at least have a partner in this. Even if it's not going to change the isolation, they'll at least have someone there with them they can access. So, but I bet, Misty, you've had even more experience with this, so we should hand it over.
Yeah, so the biggest thing that I would say, the biggest barrier for all families has always been transportation. And we see that even just with our English speaking families, there's always transportation issues, and care coordination tries to remove some of those barriers. If you can help a family, I mean, you've been to VCU, it's huge, right? If you can go with them, that makes a big difference. Give them explicit directions of where to get, taxis and things like this, helping them get there, navigating that. But I can't say enough about a primary care physician, which is why I really like to see these families get their Medicaid, because that my primary care physician, I've had him for 10 years. You slowly develop that relationship with them where you allow them more, than you feel more safe to be able to say, I'm having issues with this, I'm having these things. And then that can start to come out and working with their teams. I really think that that's a very imperative relationship, that they're seeing the same people, that they're building that trust. Because I had a kid that finally disclosed that this child had been trafficked while they were overseas. And so this took about 9 months before they felt comfortable saying this to me. And so I'm thinking, I was following these kids because CHOR, with Pete's HEMONC, we follow these kids all the way through treatment. But if I had just been a, hey, emergency person, that would have never come out. Out of that child was able to get into extensive treatment. And because of what happened to that child overseas, was able to actually get legalized to be here. So a great thing came out. The other thing is, as Social Workers Week, we do everything on strength-based perspective. And it's really important. It's hard sometimes when we look at families, but everybody has strengths-based in them, and pointing those things out. A family member, a support system, a church, a community. What are your strengths that you can build on? And really helping these families. I mean, one thing that these families are just amazing with is they have just this cohort of relationship that other families that you see that are more disenfranchised. And that is one thing, especially the Latino families, how they bring together. It's just amazing. And so building on that support, always asking, what are the positive things that you've got going on, and turn those negatives into positive. But I feel like VCU really tries to do that. But and that's where we can't do anything without our community supports, because they come to the hospital and leave. And so when we're handing those patients back off to you guys in the community, your follow-up of these families is imperative.
Thank you so much. That's so helpful. And I do want to just highlight a point that I think Dr. McKenna mentioned a little bit, but it also speaks to some of our other sessions. I know at VCU, they have the MyChart app, where if us as volunteers in the community can help our families get the MyChart app, then like Dr. McKenna said, they can be empowered to communicate with their primary care physician directly. And then that would also help with things like Misty was referring to, of us helping them remember their appointments, for example. So I know with some of the families that we work with, we help them set their MyChart app on their phone, and then they show it to us when they come for English class, and we can show them when your appointment is, and we can set up a transportation with them and try and get one of our volunteers to take them to their appointment. So I think that's a great way of empowering the families, but also helping to keep that communication between their doctor and themselves like directly open to help maybe address some of the isolation that they might feel as well. So thank you all for thank you for that question, and thank you for those responses. We have another question here in the chat. What kind of education is provided to improve the cultural competence of residents and medical students at VCU and to improve their treatment of refugees and immigrants? And what do you think is the future of this training to improve medical outreach to migrants?
Yeah, I think that's been a huge change, and I would say probably the last 20 or 30 years. So it's been a long change. This sort of education I saw introduced more in my residency than in my medical school years. So that would be more in the early 2000s than in the late 90s. And it's only grown from there. And I think all of the lessons that we learn over the years on the ways that we miss the opportunity to treat a community when we don't understand their culture has led to better and better curricula, more and more often being taught not by someone like me who's not as well versed in that community, but by the community themselves. So we're engaging with the communities to try to bring them in, whether it's that you're from another country or another culture, or you're from another community like a disability community. We're trying to get more and more of that education to happen at the resident and medical student level from those communities. So having not been in med school for the better part of 30 years, I don't know exactly what they're doing, but I do know that it's always a focus for our deans and our educators. And I've always been impressed with the lessons that I hear the students and residents talk to me about. And then the other thing is, no matter how much we teach them, the variety of experience is really the key. So learning it in the classroom is the first step, but really practicing it in the clinic space is the next. And I think that's been one of the things that I hear feedback from our students and our residents is, we're a smaller city in Richmond, but we really have a richness of diversity, both in the kinds of ways we've just been discussing and then in medical complexity. So I think our residents that I talk to are always impressed with the fact that in their experience as residents in our health system, they really get to see an incredible amount of different sorts of diseases, pathologies, patients, communities. So I think that these sorts of questions and these sorts of groups and these sorts of events are going to just keep us pushing that goal forward and getting better and better at this. But I will confirm at least that it is one of our major priorities, is to make sure that we're not missing those opportunities. We certainly takes a lifetime to get good at it, and many of us keep trying and will never be as good at it as we would like. But we recognize that it is a critical need, that if we don't understand the community we're serving and we don't know how to connect with them, then we won't be able to provide adequate care.
So one thing we have to go through cultural competence training consistently as I know as social workers and also providers. But the School of Medicine, I've been speaking over there for the past 3 years at this conference that they do. And they did one that was on global health, one that was on immigrants. And it was just flooded with medical students and residents that were asking questions. And I present with this amazing physician that is at Chiller Hospital. And he was foreign born, speaks 4 languages. And so, we've done a lot of work together as well, just communicating with the medical students. I know that they're doing a lot with global health. I tell all of everybody that I work with, I'm going on a mission trip this summer, like, you need to go overseas. And a lot of these kids, I know Dr. McKenna leads some groups as well, which now I'm interested in that. But connecting, and a lot of these medical students and residents are doing that. But the cultural competency is a big thing at the School of Medicine. Like I said, it was an entire day just on that. And they brought me in to just talk about these topics. And really, I was dealing with the complexities of trauma and working with these families because, you got to get from, hey, we're homeless, or we just got here, to all the way of dealing with what happened to you back there, and let's work through that to where you're moving forward. And I mean, I had kids that literally had seen, their homes blown up. And I mean, it just the resilience of these families are just unbelievable. So our providers are very keen to this, and I would say overall are moving. And that's why I love CHOR and VCU, because we get a lot of international students, and that's how we grow. That's how we learn, is all these come in from these other countries. They're specific.
Thank you so much, Misty. I know you were cutting out a little bit. I don't know if it was on my end or on your end. But thank you so much. That's so helpful. And definitely speaking on my own personal experience, when I was in medical school, I did form the Multicultural Coalition, and there was such a desire from the medical students to learn about other cultures. And I think now more and more, as Misty said in her presentation, how we have so many more refugees and immigrants. I think there's just so much more of a need. And then speaking to what Dr. McKenna said, in practice, you learn so much. So in my residency at VCU, I just learned a tremendous amount just by dealing with people from other cultures. And what is also really exciting is that so many of our refugees coming in have had some medical training. And as they get to a position where they learn more and more English, and they're able to then go into their fields of nursing or medicine at the hospital, then you have more foreign-born people that can speak to that experience, and that really connects with the patients. When a patient comes and sees, oh, this person's from my home country too, then that immediately builds some trust there. And as we have more of our refugee and immigrant population get into the medical system themselves as providers, then that will help other people learn from them as well. So I think we're all moving forward into a really great direction. So I think we have just a few more minutes. So if we have any last minute questions, I think we have one in the chat here. Is there a movement towards developing programs utilizing the skills of doctors and nurses who are coming from other countries but aren't licensed to practice in the U.S.? So that's perfect. Catherine had my same train of thought there. And Dr. McKenna said that is a huge challenge and an underutilized resource that really hurts the whole healthcare system. Dr. McKenna, would you like to go ahead and expand on that?
Yeah, I mean, it's usually that I'm speaking to the parents of these that are healthcare providers. So the best examples I have recently are, I imagine everybody's familiar with the challenges in Venezuela right now. And so I take care of a few different families who have refugee status from Venezuela. And the parents, either one may be a physician in Venezuela, but they're not then licensed to practice here in the US. And if they want to be, the number of tests that they have to take a certifying test, and then they have to reapply to do training again in their area of expertise. So that it becomes, re-enrolling in what was already a grueling, however many years you want to, it was 6 years, it depends on the residency that you did. So I know a lot of docs who do it, but I also know a lot of doctors who look for other jobs in the healthcare system that aren't really at their level of training, but they can still be a terrific resource for the healthcare community. But I think that ultimately, as someone who practices and works with teams in other countries, I think that we're doing ourselves a disservice in the US by not reducing those hurdles a bit, making it easy for those team members to practice here because they're here and they want to help. And we're making it really challenging for them. So I haven't heard about any movement or programs, but I also haven't been asking. So I think it's a great thing to check in with on a federal or state level.
And I would agree with Dr. McKenna. Can you hear me? I think that is a big concern for me, and I've seen that as well. Met many amazing providers that they're having to do other things, and so I also wanted to just add that there are 7 states right now in the U.S. that provide Medicaid to undocumented kids, and Virginia is not one of them.
Perfect place for somebody to be playing, but this was
Carlo.
they abandoned it, and they were one of the
Oh, go ahead. I think someone was trying to ask a question there. I think they got muted again. Carla, would you go ahead and like to talk about the International Dentist Program?
Yes, we do have an international dental program here where we have students from all over the country that come in and they complete 2 years here to actually get their certification here in the United States. And so also our students have external rotations into the community health facilities. And although we have a variety of different backgrounds in our student population, we also have that in our patient population. So on a daily basis, we're dealing with different backgrounds, different cultural experiences every day here. And so we pride ourselves in making sure that we provide the best dental care to all patients and all experiences to make sure that everyone have the best experience here. But with our Associate Dean of Diversity and Inclusion, we also offer many opportunities for our students to have an opportunity to provide the best cultural experiences to their patients as well.
Thank you, Carla. That's amazing. And I know Reestablish Richmond does partner with VCU Pathways, as Joe mentioned. If there are people that are trained in the medical field elsewhere, when they come here to kind of help them get started back on their pathway, there's also Upwardly Global is an organization that helps people find professional careers when they've been trained in other countries and come here as internationals. So I could talk about this topic for hours and hours on end, and we have such a wealth of expertise here. It's been such a wonderful hour, but I do want to be respectful of everybody's time. So I thank you all for attending this session, and I do believe this is the last session for today.